Have you ever experienced maddening, relentless itching all over your body, and yet when you look at your skin, there is absolutely nothing there? No rash, no hives, no swelling, no visible irritation whatsoever. Just this unbearable urge to scratch that gets worse at night, intensifies after a warm shower, ignores every lotion and cream you try, and laughs in the face of antihistamines. Most people in this situation eventually find themselves sitting in a dermatologist's office. They get prescribed antihistamine pills, corticosteroid creams, and perhaps an allergy panel, all of which come back normal. The dermatologist says your skin looks fine, and you leave more confused and frustrated than when you arrived. Today, I need to tell you something that most people, and even many patients, do not know. Skin that looks completely normal, but itches unbearably may not be a skin problem at all. It may be your liver specifically. Your liver's detoxification system sending you an urgent distress signal. And if you spend months or years treating only the skin, while missing this signal, the consequences can be life-altering. The liver is the largest internal organ in your body, weighing roughly 3 pounds and tucked under your right rib cage. It performs more than 500 distinct functions, continuously, making it arguably the most complex and hardworking organ you have. It filters toxins and waste products from your blood. It breaks down alcohol, medications, and chemical compounds. It produces bile, a digestive fluid essential for absorbing dietary fats. It regulates blood sugar, synthesizes proteins, stores vitamins and minerals, manufactures clotting factors, metabolizes hormones, and supports immune defense. This organ is essentially a chemical factory, a pharmaceutical laboratory, and a detoxification center rolled into one. And it does all of this silently, without complaint, for decades. Here is the critical problem: the liver contains almost no pain-sensing nerves. When it is damaged or struggling, it cannot send pain signals the way a sprained ankle or a toothache can. Additionally, the liver possesses a remarkable functional reserve. It can continue appearing to work normally, even when 60 to 70% of its capacity has been lost. This combination of silent operation and enormous reserve capacity is why liver disease has been called the silent killer. By the time obvious symptoms appear, significant damage has often already occurred. But the liver does communicate distress, indirectly, through symptoms that seem to originate elsewhere. And one of the earliest and most consistent of these indirect signals is intense, unexplained itching of the skin. The medical term for itch arising from liver or bile duct disease is cholestatic pruritus. To understand how the liver produces itching, you need to understand bile and what happens when its flow becomes obstructed. Bile is produced continuously by liver cells and travels out of the liver through a network of bile ducts, eventually reaching the small intestine, where it emulsifies dietary fats for digestion. The main functional components of bile include bile acids, which act as biological detergents. Under normal conditions, bile flows smoothly from liver to intestine and back in a continuous cycle. When this flow becomes blocked or sluggish, a condition called cholestasis, bile components begin backing up inside the liver. As pressure builds, these components, particularly bile acids, leak back into the bloodstream. Once bile acids enter general circulation, they travel throughout the body and deposit in peripheral tissues, including the skin. Here they directly stimulate sensory nerve endings, generating the sensation of itching. This is why cholestatic itch has a distinctive quality. It arises without any visible skin lesion. Because the skin itself is not the source of the problem, the irritant is within the skin tissue, deposited there by the bloodstream, not generated by the skin itself. In more advanced cases, the backup of bile pigments into the blood produces jaundice, yellowing of the skin, and the whites of the eyes. But critically, the itching very often precedes jaundice by weeks, months, or even years. This means the itch is an earlier warning signal than the yellowing, and recognizing it as such creates a window for early diagnosis. Beyond bile acids, recent research has identified lysophosphatidic acid as a key mediator of cholestatic itch. This bioactive lipid is elevated in the blood during bile flow obstruction and directly activates itch-transmitting nerve fibers in the spinal cord. through a mechanism distinct from histamine. This explains why antihistamine medications are largely ineffective for liver-derived itching. The itch is not driven by histamine at all. Other mechanisms contributing to liver itch include disruption of the endocannabinoid system, imbalances in opioid neurotransmitter signaling, and serotonin metabolism abnormalities. This multi-pathway complexity is why liver itch can be so relentless and so difficult to suppress through conventional approaches. Knowing the distinctive characteristics of liver-derived itching helps you assess whether your own symptoms warrant internal medicine evaluation. The first characteristic is the absence of primary skin lesions. The skin surface itself shows no original abnormality, only secondary changes from scratching. The second characteristic is a distribution that often begins on the palms of the hands and soles of the feet, before spreading to the rest of the body. This localization pattern is highly characteristic of cholestatic itch and rarely seen in common allergic or dermatological conditions. The third characteristic is worsening at night. Most patients describe the itch becoming significantly more intense in the evening and overnight hours, making sleep extremely difficult. The fourth characteristic is exacerbation by warmth. Hot showers, warm bedding, heated rooms. This differs from some other forms of itch that improve with warmth. The fifth characteristic is failure to respond to standard antihistamine therapy. When multiple courses of antihistamines provide little or no relief, this points strongly toward a non-histamine mechanism and should trigger evaluation for systemic disease. If 3 or more of these 5 features apply to your situation, please do not wait for a dermatologist to reassure you again that your skin looks fine. Schedule an internal medicine or gastroenterology appointment and request liver function, blood tests and liver imaging. You could be catching a serious condition early enough to make a profound difference in its outcome. Let's now examine the specific liver and bile duct diseases that most commonly produce this type of itching, so you understand the range of conditions your doctor needs to consider. Primary biliary cholangitis, formerly known as primary biliary cirrhosis, is an autoimmune liver disease in which the immune system mistakenly attacks the small bile ducts inside the liver. As these ducts are progressively destroyed, bile accumulates within liver tissue, causing chronic inflammation and gradual scarring. Intense generalized itching is often the very first symptom, appearing years before jaundice or other signs of liver failure. Primary biliary cholangitis predominantly affects middle-aged women, with the peak incidence occurring between ages 40 and 60. If you are a woman in this age range, experiencing persistent unexplained itching, this condition belongs at the top of your diagnostic consideration list. It is diagnosed through blood tests showing elevated alkaline phosphatase, elevated GGT, and positive anti-mitochondrial antibodies. Caught early, treatment with ursodeoxycholic acid can significantly slow disease progression and may even halt it entirely. Primary sclerosing cholangitis is another chronic bile duct disease, this one characterized by progressive inflammation and fibrosis of both the intra and extrahepatic bile ducts, causing them to narrow and eventually obstruct. It has a strong association with inflammatory bowel diseases, particularly ulcerative colitis, affecting predominantly men between ages 30 and 50. Cholestatic itching is a prominent symptom, and the disease unfortunately lacks a proven medical treatment that stops progression, meaning some patients eventually require liver transplantation. Critically, primary sclerosing cholangitis carries a 10 to 15 times elevated risk of cholangiocarcinoma bile duct cancer, making regular surveillance imaging essential. Chronic viral hepatitis, specifically hepatitis B and hepatitis C, produces ongoing liver inflammation that can impair bile flow and trigger itching, particularly as liver damage advances toward cirrhosis. Hepatitis B remains a significant public health concern in many parts of Asia, where maternal-to-child transmission historically created high rates of chronic infection. Many people with chronic hepatitis B are unaware of their status, having been infected at birth before the immune system could mount a response. Unexplained itching may occasionally be the symptom that first brings these patients to medical attention. Hepatitis C, known for producing remarkably few symptoms during its decades-long silent progression, similarly can present with itching. As an early indicator of developing liver impairment, alcoholic liver disease progresses through a well-characterized sequence: fatty liver, alcoholic hepatitis, and cirrhosis. Alcohol directly damages hepatocytes through its toxic metabolite, acetaldehyde, generates massive oxidative stress and disrupts gut microbiome balance in ways that flood the liver with bacterial endotoxins through the portal vein, amplifying inflammatory damage. When alcoholic liver disease sufficiently impairs bile processing, blood bile acid levels rise and itching develops. Anyone with a history of significant alcohol use who experiences unexplained itching must take this symptom seriously and seek hepatological evaluation promptly. Non-alcoholic fatty liver disease has become the most prevalent liver condition globally, driven by the epidemic of obesity, insulin resistance, type 2 diabetes, and metabolic syndrome. Fat accumulation in the liver without significant alcohol consumption advances in some patients to non-alcoholic steatohepatitis, fatty liver with active inflammation, which can progress to cirrhosis and liver cancer over 1 to 3 decades. Because non-alcoholic fatty liver disease produces no symptoms, in its early stages, unexplained itching emerging in someone with metabolic risk factors may represent the first perceptible sign of advancing liver disease that deserves urgent evaluation. Cirrhosis itself, the end stage of chronic liver damage, where normal liver tissue has been replaced by fibrous scar tissue, impairs all liver functions, including bile production and flow. Itching in patients with cirrhosis can be severe and profoundly disruptive to quality of life. Cirrhosis also raises the risk of hepatocellular carcinoma, dramatically reinforcing why regular surveillance is non-negotiable. For anyone with known cirrhosis, drug-induced cholestasis deserves specific emphasis, because it is both common and correctable. A remarkably wide range of medications can impair bile flow as a side effect, including certain antibiotics, antifungals, anticonvulsants, antihypertensives, oral contraceptives, anabolic steroids, antidepressants, and even herbal supplements and traditional remedies. Drug-induced cholestasis should be considered any time itching develops shortly after starting a new medication. Removing the offending drug usually leads to resolution, but identifying which drug is responsible requires careful medical evaluation. Beyond the liver and bile ducts, several other systemic diseases produce itch through entirely different mechanisms and deserve mention. Chronic kidney disease generates pruritus through accumulation of uremic toxins that cannot be cleared by failing kidneys. This is called uremic pruritus, and is particularly severe in patients on dialysis. Polycythemia vera, a blood cell disorder, produces a distinctive aquagenic pruritus. Intense itching triggered specifically by contact with water, including showering, bathing, or swimming. This water-triggered itch pattern is so characteristic that it should immediately prompt a blood count check. Hyperthyroidism increases skin blood flow and nerve sensitivity, producing diffuse itching alongside other thyroid excess symptoms. Lymphoma, particularly Hodgkin lymphoma, is well recognized for causing systemic pruritus as an early manifestation, before lymph nodes become palpably enlarged. The common thread connecting all these causes is that the itch arises from a systemic process, rather than a skin disease, and this is precisely why the dermatologist's repeated reassurance that the skin looks normal fails to solve the problem. When should you definitively seek internal medicine evaluation, rather than continuing dermatological treatment? The thresholds are clear. Any unexplained pruritus persisting beyond 6 weeks, without an identifiable dermatological cause warrants systemic evaluation. Any pruritus accompanied by dark urine, pale stools, fatigue, right upper quadrant discomfort, or yellowing of the eyes or skin requires urgent internal medicine assessment. Any pruritus triggered by water contact needs a complete blood count. Any pruritus that began shortly after starting a new medication needs medical review of that drug. And any pruritus in someone with known metabolic risk factors, heavy alcohol use, viral hepatitis status, or family history of liver disease, should prompt liver function testing without delay. Now let's focus on what you can do how to protect and restore liver health. Reduce the toxic burden your liver carries, and support its detoxification capacity through evidence-based lifestyle choices. The single most impactful change most people can make for liver health is eliminating or substantially reducing alcohol consumption. Alcohol's primary toxic metabolite, acetaldehyde, directly alkylates and damages hepatocyte DNA and proteins. The liver oxidizes acetaldehyde through enzymatic pathways that simultaneously generate reactive oxygen species, creating oxidative stress that kills liver cells. Alcohol also disrupts intestinal barrier function, increasing gut permeability and the flux of bacterial endotoxins through the portal vein into the liver. This combination of direct hepatotoxicity and indirect inflammatory amplification through gut-liver crosstalk means that even moderate regular drinking progressively damages the liver in susceptible individuals. For anyone with existing liver disease of any cause, zero alcohol is the only safe recommendation. For those without diagnosed liver disease, current evidence suggests that the risks of alcohol to the liver begin at levels well below what most people consider problematic drinking. Diet modification, specifically targeting liver fat reduction, is the most effective non-pharmacological treatment for non-alcoholic fatty liver disease, the primary dietary driver of liver fat accumulation in most people is not dietary fat itself. It is excessive carbohydrate intake, particularly fructose and refined carbohydrates. Fructose is metabolized exclusively by the liver, and when consumed in large quantities through sugar-sweetened beverages, fruit juices, processed foods, and sweet snacks, it overwhelms the liver's metabolic capacity and is converted directly into triglycerides that accumulate as liver fat. Reducing fructose and refined carbohydrate intake is therefore a high priority dietary intervention for liver health. Foods with specific evidence of liver benefit deserve attention. Coffee is one of the most robustly studied dietary interventions for liver health. Multiple large prospective studies have found that consuming 2 to 3 cups of coffee daily is associated with a 40 to 50% lower risk of developing cirrhosis and a significant reduction in liver cancer risk across a range of underlying liver diseases. The mechanisms involve chlorogenic acids and caffeine, reducing hepatic inflammation and fibrosis signaling. Filtered black coffee provides these benefits without the caloric and glycemic penalties of sweetened coffee drinks. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, cabbage, kale activate phase 2 detoxification enzymes in the liver through their sulforaphane content. Sulforaphane is converted from glucoraphanin upon cell disruption during chewing and stimulates the NRF2 pathway, which upregulates the production of glutathione, the liver's master antioxidant and most versatile detoxification molecule. Optimal sulforaphane release requires raw or lightly steamed preparation. Eating cruciferous vegetables 3 or more times weekly provides meaningful support for hepatic detoxification capacity. Garlic's organosulfur compounds, particularly allicin and dialyl L-disulfide, activate hepatic detoxification enzymes and reduce oxidative stress within liver tissue. Garlic also contains selenium, a trace mineral that serves as a cofactor for glutathione peroxidase, one of the key antioxidant enzymes protecting liver cells from oxidative damage. Raw or minimally processed garlic delivers more active allicin than heavily cooked preparations, though any inclusion of garlic in the diet provides benefit. Turmeric curcumin, when delivered in a bioavailable form and combined with piperine from black pepper to enhance absorption, has demonstrated in multiple studies the ability to reduce hepatic inflammation, decrease liver enzyme elevations, inhibit stellate cell activation and fibrosis progression, and lower the risk of fat accumulation in liver tissue. Standard turmeric powder has very poor bioavailability, absorbing at less than 1%. High absorption formulations liposomal curcumin, BCM95, or curcumin, combined with piperine deliver meaningfully higher blood and tissue concentrations. Incorporating turmeric with black pepper into daily cooking or using a quality high absorption supplement provides a practical approach. Green tea's epigallocatechin. Gallet has shown consistent benefits in reducing liver fat content and lowering elevated liver enzymes in non-alcoholic fatty liver disease. A clinical study using green tea extract supplementation in patients with non-alcoholic fatty liver disease demonstrated significant reductions in ALT and AST. 3 to 4 cups of brewed green tea daily is a sustainable approach, though the benefits appear dose-dependent. Brewing at 170 to 185 degrees Fahrenheit for 2 minutes extracts catechins effectively without excessive bitterness. Beetroot contains betaine, which protects liver cells from oxidative damage and inhibits fat accumulation in hepatocytes through a mechanism called methyl donation. Betaine provides methyl groups that stabilize liver cell metabolism and reduce homocysteine, a compound that stresses liver tissue at elevated concentrations. Beetroot also contains nitrates that improve hepatic blood flow. Regular consumption of beets, whether roasted, juiced, or added to salads, provides these protective compounds. Avocados provide precursors to glutathione, glutamate, cysteine, and glycine alongside healthy monounsaturated fats that reduce hepatic lipid metabolism stress. Walnuts deliver plant-based omega-3 fatty acids, arginine for nitric oxide production, and polyphenols that reduce hepatic inflammation. Both foods have been associated with improvements in liver health markers. In observational and clinical research, adequate hydration supports hepatic function by maintaining appropriate blood viscosity for efficient toxin filtration and ensuring adequate bile flow. Insufficient hydration concentrates bile and increases the risk of bile thickening and sludging. 6 to 8 glasses of water daily, with particular emphasis on drinking a full glass upon waking to counteract overnight dehydration, supports optimal hepatic perfusion and bile flow throughout the day. Foods to minimize or eliminate for liver health include ultra-processed foods containing high fructose corn syrup, trans fats, artificial additives, and industrial seed oils. Red meat in large quantities increases hepatic fat through saturated fat and heme iron mechanisms. Added sugars in all forms drive de novo lipogenesis in the liver. Highly salted foods, though not directly hepatotoxic, contribute to metabolic syndrome. Components that burden the liver indirectly. Exercise is the most powerful lifestyle intervention for non-alcoholic fatty liver disease, with evidence suggesting it rivals pharmaceutical options in reducing hepatic fat content. Aerobic exercise mobilizes liver fat by increasing fat oxidation in skeletal muscle and improving hepatic insulin sensitivity. The reduction in liver fat begins within days of starting regular exercise, even before significant weight loss occurs. A minimum of 150 minutes of moderate intensity aerobic activity weekly is recommended, with evidence supporting greater benefit from 250 minutes or more. Resistance training independently reduces liver fat and improves insulin sensitivity, and is best combined with aerobic exercise as a complementary strategy. Both aerobic and resistance training increase hepatic blood flow, support hepatic detoxification enzyme activity, and reduce the systemic inflammation that drives hepatic injury. Among supplements with the most evidence for hepatoprotective effects, milk thistle's active compound silymarin deserves first consideration. Silymarin stabilizes hepatocyte cell membranes, reducing their permeability to toxins. It stimulates hepatocyte protein synthesis to accelerate cell regeneration. It scavenges free radicals produced during metabolic stress, and it reduces the inflammatory signaling that drives fibrosis progression. Clinical evidence supports its use across alcoholic liver disease, non-alcoholic fatty liver disease, and toxic hepatic injury. Doses of 140 to 420 mg of standardized silymarin daily are used in research. Choose products standardized to 70 to 80% silymarin content for reliable dosing. N-acetylcysteine is the direct precursor to glutathione, the liver's master detoxifying antioxidant. Its hepatoprotective efficacy is so well established that it serves as the standard emergency treatment for acetaminophen overdose-induced liver failure. For general liver health support, 600 to 1,200 mg Daily supports glutathione replenishment and protects against oxidative hepatic damage. Alpha-lipoic acid is unique among antioxidants in being both water and fat soluble, enabling it to protect all cellular compartments from oxidative damage and regenerate other antioxidants, including vitamin C, vitamin E, and glutathione. Clinical trials in non-alcoholic fatty liver disease have shown reductions in liver enzyme levels and improvements in insulin resistance with 300 to 600 mg daily. Vitamin E at 800 IU daily demonstrated significant reduction in hepatic inflammation and liver enzyme elevation in a large, randomized controlled trial of non-alcoholic steatohepatitis in non-diabetic adults, one of the few nutrients to show this level of evidence in this condition. Long-term high-dose vitamin E supplementation should be discussed with a physician. Omega-3 fatty acids at doses of 2 to 4 grams of combined DHA and EPA daily. Reduce hepatic triglyceride synthesis, lower circulating triglycerides, reduce hepatic inflammation, and support the metabolic environment that prevents fat accumulation in liver tissue. A critical warning about supplements and traditional herbal remedies. Herbs marketed for liver health can themselves cause serious liver damage. Drug-induced liver injury from herbal and dietary supplements is a significant and growing clinical problem. Products containing green tea extract in concentrated supplement form, kava, comfrey, pennyroyal, greater celandine, and various traditional Asian herbal formulations have all been documented to cause hepatotoxicity, sometimes severe, occasionally fatal. The tragic irony is that people taking herbal preparations specifically to protect their liver sometimes cause the very damage they are trying to prevent. Anyone with diagnosed liver disease must disclose all supplements and herbal products to their physician without exception. And for anyone experiencing unexplained itching or liver symptoms, initiating multiple herbal supplements based on internet research before receiving a diagnosis is potentially dangerous. Let's address the specific question of when to act and what to say to your doctor if you have been experiencing unexplained itching for more than 6 weeks, with or without visible skin changes, and standard dermatological treatment has not resolved it. Make an appointment with an internal medicine physician or gastroenterologist. When you arrive, bring a written record of the following information: when the itching started, what time of day it is worst, whether it is worse after warm showers or at night, which parts of your body are affected, what treatments you have tried, and whether they helped. A complete list of all medications and supplements you currently take, your alcohol consumption history honestly described, whether you have diabetes, obesity, or metabolic syndrome, whether you have ever been tested for hepatitis B or C and what the results were, and whether any family members have liver disease or liver cancer. The evaluation your physician should initiate includes liver function tests, including ALT, AST, alkaline phosphatase, GGT, and total and direct bilirubin. If alkaline phosphatase or GGT are elevated, anti-mitochondrial antibody testing and serum bile acid measurement are appropriate next steps. A complete blood count evaluates for anemia, polycythemia, or lymphoma indicators. Kidney function tests and thyroid function tests exclude renal and thyroid causes. Abdominal ultrasound evaluates liver size, echogenicity, gallbladder, and bile ducts. If ultrasound suggests biliary obstruction, magnetic resonance cholangiopancreatography and MRI, specifically designed to image the bile duct system, provides high-resolution assessment without invasive procedures. What to do tonight while you are waiting for your appointment? Take a brief lukewarm shower, rather than a long hot one, since heat worsens cholestatic itch. Pat skin dry gently rather than rubbing. Apply a fragrance-free, low-irritant moisturizer to damp skin immediately after drying. Wear loose-fitting, soft cotton clothing rather than synthetic fabrics. Keep your bedroom cool. Keep your fingernails short to minimize skin trauma from inadvertent scratching. Apply a cold compress to the itchiest areas. Cold sensation competes with itch signals in spinal cord pain pathways and provides temporary relief. Avoid alcohol completely. Begin drinking 8 glasses of water daily. I want to close with the most important message of this entire video. Your skin is not lying to you when it itches. But it may be reporting news from somewhere else entirely. From an organ that cannot speak for itself, that works silently in your body, performing hundreds of functions every day. And that is asking for your attention through the only means available to it. When your liver's detoxification system becomes overwhelmed or obstructed, the toxins that should have been cleared accumulate in your blood and deposit in your skin. Your skin then does exactly what skin is supposed to do. When irritated from within, it signals urgently for help. The signal is real, but the address you need to send help to is not the dermatologist's office. It is the internal medicine clinic, where the conversation can begin about what is really happening inside your body. You now know what to look for, when to act, and what questions to ask. Unexplained itching without visible skin disease, particularly if it resists antihistamines and worsens at night and after warmth, that is your liver's SOS. Hear it, answer it, and please share this video with anyone you know who has been suffering from unexplained itching without answers, because the answer they need may be found not on the skin, but within it. If this video was valuable to you, please subscribe and like. It helps this information reach the people who need it most. Leave a comment telling us whether this video changed how you think about your symptoms, or let us know what health topic you would like us to cover next. Take care of your liver. It has been taking care of you your entire life. Thank you for watching.